Welcome everybody to this lecture. Today we will explore the meaning of food sustainability and its relationship with global health law, namely the set of international norms and organizations working for the attainment by all peoples of the highest possible level of health. The concept of food sustainability is employed here to denote a food system that ensures food security and nutrition for all in such a way that economic, social, and environmental bases to generate food security and nutrition of future generations are not compromised. In other words, this means that a sustainable food system is one that is profitable, has broad benefits for society, and has a positive or neutral impact on the natural environment. Within the broader framework of sustainable development, global health law has been conceptualized as representing a precondition for and an outcome and an indicator of the social, economic, and environmental dimensions of sustainable development and the implementation of the 2030 Agenda. Indeed, global health law plays a vital role in guaranteeing food sustainability. Global health law contributes concretely to achieving food sustainability through different strategies, policies, and legal instruments that address each of the pillars of sustainability, the sociocultural, economic, and environmental one. In doing so, we will focus on different initiatives championed by the World Health Organization, programs to promote safe and healthy diets and to combat obesity, the Universal Health Coverage Program to provide accessible health service to all, and the One Health approach aimed at protecting human as well as animal and environmental health. With respect to the sociocultural aspects of food sustainability, global health law aims to guarantee the fundamental right of access to food that is healthy, safe, nutrition, and culturally accepted or associated with cultural tradition. These objectives lies at the heart of the three main initiatives led by the World Health Organization to address directly and indirectly healthy diets and nutrition. The first one is represented by the establishment of the Codex Alimentarius Commission, a food safety standard setting organization responsible for the Codex Alimentarius, a collection of internationally adopted food standards and related texts presented in a uniform manner with the primary aim of protecting consumer health and ensuring fair practices in food trade. The Codex encompasses a range of measures related to all major foodstuffs, including, for instance, the regulation of additives, pesticides, contaminants, labeling processes, methodologies of analysis and sampling, and inspection and certification of imports and exports. Since 2000, the World Health Organization agenda has also included a program to address the four major chronic non-communicable diseases, namely cardiovascular disease, cancer, chronic respiratory disease, and diabetes. For the nutritional aspects, in 2004, the WHO adopted the Global Strategy on Diet, Physical Activity, and Health, which highlights the links between non-communicable disease and food sustainability. The overarching goal of the global strategy is to guide member states in promoting and protecting health through sustainable action, to reduce disease and death from unhealthy diets, and to increase sustainable benefits for high-risk individuals. States are encouraged to develop, strengthen, and implement policies and action plans to improve diets and increase physical activity that are sustainable, comprehensive, and actively engage all sectors. To this end, the global strategy stresses the need to adopt national food and agricultural policies that include sustainable food security and food programs that emphasize empowerment and development, local production, and sustainability. Finally, in 2019, the Food and Agriculture Organization and the World Health Organization adopted jointly the guiding principles on sustainable healthy diets, supported by the respective actions for the implementation of sustainable healthy diets, which together represent the most pertinent and comprehensive instruments dealing with the issue of food sustainability in global health law. The guiding principles have been developed to reduce the prevalence of diet-related non-communicable disease, but also to halt and potentially reverse the escalation of environmental degradation. Indeed, sustainable healthy diets have the potential to elevate environmental, sociocultural, and economic considerations to the forefront, thereby enabling healthy diets for all and rendering agri-food systems more sustainable. Global health law also contributes to the economic pillar of sustainable development. Indeed, a part of the WHO efforts is constantly focused on the advancement of sustainable health financing mechanism. In the aftermath of COVID-19, the World Health Organization has sought to boost the economic resources necessary to support its activity, sustainable healthy diets-related issues, but also healthcare services. The financial sustainability of healthcare services is the primary objective of the universal health coverage, which means that all people have access to the full range of quality health services they need, when and where they need them, without financial hardship. It covers the full continuum of essential health services, from health promotion to prevention, treatment, rehabilitation, and palliative care across the life course. Nonetheless, achieving universal health coverage not only requires financial sustainability, but also a broader transformation of food systems, since it cannot be attained without ensuring universal access to safe, high-quality, and sustainably produced food. Consequently, integrating comprehensive sustainable nutrition strategies into healthcare systems is essential to achieving universal health coverage, which ultimately means giving people a fairer opportunity to fully enjoy their right to health. With regard to the economic pillar of food sustainability, the overarching objective of global health law is to address the interlinkages between environmental protection and global health, to overcome their fragmentation and foster their convergence. To this end, the international institutional response has emerged in a form of the One Health approach, defined as an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems, to foster well-being and tackle threats to health and ecosystems while addressing the collective need for clean water, energy and air, safe and nutritious food, taking action on climate change, and contributing to sustainable development. The convergence between the One Health approach and food sustainability indeed has the potential to address the significant risks deriving from unhealthy contamination in the global food chain. It is widely acknowledged that food of both animal and plant origin can act as vehicle for foodborne exposure to antimicrobial resistance, as well as to zoonotic spillover, both of which contribute to the amplification of disease. The One Health approach until now has merely materialized in an arrangement to strengthen cooperation among international actors competent in each single area to form the quadripartite agencies: the World Health Organization, the Food and Agriculture Organization, the World Organization for Animal Health, and more recently, the United Nations Environmental Programme. While this partnership has the merit of matching different aspects of health, including environmental health, and consequently covering elements of food sustainability, the One Health approach has some significant limits, as it remains merely an approach which is not yet supported by international legal instruments. To conclude, we can affirm that global health law certainly contributes to the pursuit of food systems that are not only profitable, but also have societal benefits and a predominantly neutral impact on the environment. The adoption and implementation of international instruments in the domain of global health law is facilitating the aim of guaranteeing healthy, sustainable, and culturally appropriate diets. These instruments also support the economic burden of healthcare and preserve animal and environmental health alongside human health. Achieving food sustainability requires the adoption of a comprehensive approach to match all these variables and to balance global health law with other international regimes. Within this framework, the World Health Organization's efforts are becoming more and more central in achieving food sustainability through a more integrated and comprehensive legal architecture that governs contemporary global health challenges.